Dr. Nancy will be speaking on the etiological analysis of vitreous hemorrhage at a tertiary care center in North India.
Shall I start? Good morning. So I'll be presenting my free paper on this topic. Vitreous hemorrhage is the presence of extravasated blood within the space lined by internal limiting membrane of the retina posteriorly, non-pigmented epithelium of the ciliary body laterally, lens zonular fibers, and posteriorly lens capsule anteriorly. The incidence of vitreous hemorrhage is 7 cases per 1 lakh population. Vitreous hemorrhage is a common cause of sudden painless loss of vision, which usually present with sudden appearance of floaters, smoke signals, perception of red or black shadows, and cobwebs. It is important to determine the underlying etiology of vitreous hemorrhage, as the treatment and visual prognosis depend on the underlying cause. Timely management of vitreous hemorrhage can prevent sight-threatening complications. Our aim was to study the etiology of vitreous hemorrhage in patients attending tertiary care center to find the most common systemic association of vitreous hemorrhage. It was a hospital-based study, a cross-sectional study conducted in tertiary care center in North India after taking IEC clearance. Duration was 2 years. 80 patients were enrolled in a study after taking informed consent. Only those who gave consent were included in the study. After taking a detailed history, ocular examination was done in systemic way in every patient, and best corrected visual acuity, pupil slit line biomicroscopy, IOP were done. Detailed fundus examination of both eyes was done, and USG-B scan was done for posterior segment evaluation in hazy media. All data collected were entered into computer software and analyzed accordingly. Laboratory investigations included blood pressure, blood sugar, including HbA1c, CBC, lipid profile, Montauk's test, coagulation profile, ESR, ECG, chest X-ray, CT scan, echocardiography were done wherever needed. The results of a study were, in a study, 70% were males, 30% were females. Bilateral involvement was done in 20%. Mean age of patients was 46.6%, ranging from 2 months to 70 years. Most common presenting complaint was sudden loss of vision in 52% of our patients. The presenting visual acuity 6/18 to 6/6 were present in 17 patients, 6/60 to 3/60 in 23 patients, and most of the patients were having their visual acuity between 3/60 to PL positive. Now this pie chart shows that 38% patient had PDR as the etiology, followed by trauma, and in case of PDR patients, most of the patients were type 2 diabetes mellitus, and in case of trauma, most of the cases were closed globe injuries. Now among the systemic association, most of the patient had diabetes, followed by diabetes and hypertension in 13%. In discussion, most of the cases, males were common, as followed by Lean, JC et al., Fogart et al., and Sharma et al., and this may be due to the more outdoor activities by the male patients, and unilateral involvement was more in Spring et al. And Raghuvanshi et al., as in line with these studies, and majority of the patient presented with visual acuity with less than 3/60, and these studies were in line with Maninder et al. And Fogart et al. The results of a study were variable, some similarities and some differences with a study. In a study, diabetes mellitus was the most common systemic association, which was in line with Desai et al. And Fogart et al. In a study, PDR was found to be the most common etiology of vitreous hemorrhage, as in line with Fogart et al., Desai et al., Wong et al. Also reported PDR to be the most common cause of vitreous hemorrhage, in contrary to Maninder et al., which show that BRVO in their study, BRVO was the most common cause. In a study, most of cases in PDR group had type 1 diabetes mellitus, which was in line with Dana et al.
Please finish.
In a study, majority of the patients had findings suggestive of vitreous hemorrhage. You can see in this B scan picture, there are membrane echoes suggestive of vitreous hemorrhage. Also, among the rare cases was the case of a shaken baby syndrome with a subhyaloid hemorrhage. We had one case, and we had one more case of advanced ROP with a vitreous hemorrhage. Now, common etiology is for vitreous hemorrhage was PDR in our case, and adequate laboratory investigations are needed to correlate systemic associations. These are my references. Thank you.
You did not tell us about the duration for which this vitreous hemorrhage was present.
Actually, sir, we don't have the posterior segment in our hospital. So when we find such cases of vitreous hemorrhage or anything, we refer such patients. So as soon as they came to us, so most of the cases were referred. So for the duration they were present, it also varied among the patients. Some said that we had this loss of vision and we didn't report to the doctor. Some were coming after 3 months. Some were immediately coming. That was.
Did you find any case with a PVD, hemorrhagic PVD, and did you examine the
Sir, PVD,
periphery
yes.
of these cases wherever it was possible?
Yes, sir,
Because,
PVD was there.
Tertiary is also a common cause of vitreous hemorrhage.
So,
and
but in
especially
our
elderly.
case, PDR followed by trauma was there. Yes, sure, there were cases of PVD also, but we didn't find much cases that were not on the higher side.
You have completely excluded the young age group. In young age also vitreous hemorrhage occurs.
Yes, sir, there
Vasculitis?
are vasculitis. Yes, sir, I have mentioned, but in our
BRVO
study,
can be because of anything. Vasculitis.
sir, there were other causes also, but
Yeah.
they were in minority in my study. PDR followed
As,
by trauma, then in
Dr.
few
Sharma
cases
told
were,
you that in the RD cases also you have, in acute
Of
PVD
course,
you
of-
have.
of course,
Even
sir,
in
there
the
were
Valsalva
cases.
maneuver you can have vitreous hemorrhage.
of course, sir.
So
Of course, there
you
were
are
cases.
only restricted to diabetic retinopathy
Sir,
or hypertensive retinopathy because BRVO, what did you find the cause for BRVO? If it is vasculitis, it will recur.
yes,
It
sir.
has to be treated.
Yes, sir, there were cases, but I am saying that they were in minority. I have mentioned they were 1%, 4%.
Okay.
But most of them, the most common cause which I have found in my study was PDR followed by trauma. Less common causes included, of course, they included CRVO, BRVO, vasculitis, but there were few cases which were reported.
What was the treatment modality?
So, in which cases?
Vitreous hemorrhage, if it is not resolved?
Sir, as I already said that we used to refer such cases. My study was up to diagnosing the etiological. Thank you.
Thank you very much.
Yeah, just a minute, it would have been worthwhile if you had classified these into the different age groups, you know?
Yeah.
The etiological, I mean, just
Below 20,
mentioning the
20 to 40,
etiology and
40 to 60.
Noted,
percentage.
ma'am, noted.
Yeah.
You would have correlated it with the age group, that would have made it more worthwhile.
Thank you, ma'am.
And in one of your slides, you said that type 1 diabetes was the most common. And then while you were speaking, you said that most of the patients had type 2. And one of
Maybe.
your slides said type 1.
Ma'am, that
So
would be a
just
speaking error, but it was type 1. For
type
sure.
1.
Type 1 was more common.
Okay.
Yes.
Type 1 patients.
Yes.
Okay. Type 1 with vitreous hemorrhage is also many
Yes.
of them. Okay.
Any anti-VEGF were given for vitreous hemorrhage?
She referred.
No
they
treatment
referred-
was given.
They referred
Treatment
all
was
the patients.
You referred all the cases.
Yes, sir.